So the most important thing is that if the patient is already on ACE inhibitor, you have to keep a gap of 36 hours. So get off the ACE inhibitors. You can give a ARB meanwhile if you want to give it, and then you should give the ARNI after a gap of 36 hours of the last ACE inhibitor dose. Now what are the equivalent doses? So somebody who is on say valsartan or equivalent dose to valsartan of less than 160 milligram per day, or enalapril or equivalent ACE inhibitor less than 10 milligram per day, you can begin with 50 milligram BID dose. If they are more than that dose, then you can use even 100 milligram BID. Then you wait for a week or two depending upon how the patient is responding, and then you can gradually escalate the dose, and we should try to go on the maximum possible dose. So 50 milligram BID is the minimum dose, and then you escalate after 2 weeks to 100 milligram BID. If the patient is tolerating, go to 200 milligram BID. Those patients who are already having very high blood pressure, you can begin with a higher dose. I typically begin with 100 milligram BID and then escalate up to 200 milligram BID after seeing the response. If the patient is on the lower normal side blood pressure, in fact sometimes I start with 50 milligram half BID, which is not mentioned in the trial, but this is what we do practically, and gradually step up. So you have to see the response, how your patient is responding, and then go up with the ARNI doses. We can reduce other BP lowering medications if they are not beneficial for the heart failure patient. Suppose somebody is on amlodipine, please reduce those amlodipine. You can adjust the dose of diuretics because they start feeling better and already they are decongested, so you can reduce the dose of diuretic, and then which can help you to escalate the dose of ARNI, which is an extremely important drug for heart failure patients. Thank you.